Welcome to Global Products Orthopedic Electronic Health Records and Practice Management Software. This is the main login screen. We'll log into the software. Once we log in, we are taken to the dashboard. The detailed navigation menu is there on the left hand side, which can be expanded, closed, and these images in the dashboard are shortcuts to the most frequently used parts of the software or the sub-modules. To record orthopedic information, we click on patient to consult. It will show a listing of all the patients that have arrived into the hospital. Click on the name of the patient, which will take us to the patient chart. The topmost part of the patient chart displays the patient demographic information, his name, address, email ID, and the first tab is the face sheet, which will show the diagnosis which is recorded, medications, allergies, and the past encounter histories. Next is the recording the anatomic approach for these joints such as the shoulder, proximal humerus, elbow. The approach can be selected from the drop down menu, such as for shoulder select lateral, and the corresponding interval in the muscle nerve finding for the selected approach for shoulder. Next is the proximal humerus. Select from these and we select the interval muscle nerve. Similarly for elbow, forearm, wrist, pelvis, hip, anterior Smith-Peterson, anterolateral Watson-Jones, femur bone, knee, leg, and ankle, and the corresponding interval muscle nerve findings for each of these previous joints. So these interval muscle nerve information clinical can be selected from the drop down menu and save. Summary, if any, for each of these can be typed into this free text format, the text box, and the information recorded. Next up are the special tests. Such as inspection, palpation, range of motion, neurovascular assessment, if any, that information can be typed in, and special tests. Description and summary can be typed into the free text format and recorded. Coming to the fracture description, we click on the fracture description tab to record the relevant information. Integrity of skin, soft tissue. Select from the drop down menu. Location, fracture pattern, displacement, blood loss, description and summary can be typed into the text boxes. There is an image for a fracture description which can be edited Using the built-in image editor, we click on the image or view edit fracture, and it will open in the image editor, and it can be marked up and save. And the information can be saved into the software by clicking on record. Next are the spine injury details recording. That's a compression injury. Again, selecting from a list of drop down. Flexion injury, extension injury, rotational injury, Jefferson fracture, atlantoaxial and dense fractures, C2 fractures, fractures above C4, fracture in the middle of the cervical spine, and thoracolumbar trauma. This information can be selected from the drop down list. Then a neurologic exam information can also be recorded, such as dermatomes, myotomes, central cord syndrome, Brown Sequard syndrome, anterior cord syndrome, Conus medullaris syndrome, and cauda equina syndrome. So all of this information can be simply selected from the drop down list, and the image of the spine can be edited or marked up using the image editor as shown previously. This shows the diagram of the image of the spine, which can be marked up and saved. Coming back to the patient chart, spine injury. The description and summary as before can be typed in using the free text box format. Next are the joint, by clicking on the joint tab. Flexion, extension, abduction and adduction. These images too can be opened and marked up in the image editor. So we click on the image and it opens up in the image editor. And it can be marked up. And save. Similarly, the pelvis image is there, which opens up in the image editor for markup and editing. The image of the knee joint, the wrist, all of this information can be recorded. And coming to the knee tab, the observation type listing is given, and the actual observation and summary can be recorded in free text format. The observation type such as varus deformity, surgical scars, range of motion, and summary of maneuvers for knee exam. The relevant can be selected by clicking on the checkbox. A listing of clinical observation is given against the name of the maneuver, and remarks, if any, can be recorded in free text format in the remarks text boxes for the relevant maneuver and the clinical observation. Here too, the knee image opens up in the image editor and it can be marked up, and the information saved in the software. Next is the shoulder joint. Here too, observation types are listed. There is observation and palpation, active range of motion, flexion, extension, and abduction. A range of motion, internal, external rotation, passive rotation, range of motion, the rotator cuff, and the relevant information, observations, and summary can be saved. Again, summary of maneuvers for the shoulder exam. The relevant can be selected by clicking on the checkbox. The name of maneuver and clinical observations are listed. Remarks, if any, can be typed into the text box corresponding to the relevant selection for maneuver and clinical observation. The shoulder joint image can be opened in the image editor as before and marked up. In this way, the orthopedic information can be recorded in the orthopedic EHR and practice management software from Global Products. Thank you.